We're going to start today with fake and poor quality medicines. They kill an estimated 1 million people every year. But the problem for the patient is that it's impossible to tell the difference between which drugs are genuine and which aren't. Well, now a new invention which is being trialled in Kenya could give them the real deal, as Hannah McNeish reports.
Buying drugs in Africa is a lottery. The stakes are high and the potential health losses are huge. One of these should make you better, the other could make you feel much worse. But only an expert can say which is which. For Referral Juang, it was a gamble that nearly had serious consequences when her daughter was unknowingly given poor quality medication for pneumonia.
We took her to the doctor and he prescribed antibiotics, which I went to buy at the chemist, and I gave her. But 3 days later, she was not recovering. She kept getting worse.
Pharmacists in Kenya say that instead of the vital ingredients they're supposed to contain, some life-saving drugs are degraded or packed with cheap household items like chalk, talcum powder, or worse. But now, this simple piece of paper could restore consumer confidence and save countless lives.
Well, these test cards are a tool that we can use to do a quick field screening of medicine to see if it contains the right active ingredients and to see if it contains materials that shouldn't be in a pill or a tablet.
The test paper uses chemicals that react with the medicine being tested. They generate a row of colours that can be used to reveal if the drug is high or low quality. At the main hospital in the western city of Eldoret, researchers hope the test will help health workers keep low-grade and counterfeit drugs at bay.
What it boils down to is ensuring patients get good pharmaceuticals, and we can reduce the number of deaths associated with counterfeit drugs, and eventually we can eradicate the whole counterfeit business from Kenya.
Anyone who knowingly sells low-quality medicines is unlikely to be open about it. So pharmacist Felix Were has to send out secret shoppers to gather up to 60 samples of the same medicine.
When drug inspectors go out there, they're already known, so the farmers will try and give them the best quality they have because they work for the Pharmacy and Poisons Board. While the general public, when they go out there, they easily blend in and they're given the quality they could give anybody.
Back in the lab, a team of students is putting the test through its paces to ensure that it could be used by anyone quickly and accurately. The eventual aim is to place them in pharmacies nationwide for just 10 cents each.
I guess what we envision is giving the power back to the people, whereby patients will come to the pharmacy, they will buy drugs, but they will want to know the quality of the drugs, and they will have the ability to test the drugs that they are purchasing.
The team's own tests on a range of everyday medicines like antibiotics have already proven that some are missing vital ingredients. For Referral Juang, the ability to trial before you buy would have made all the difference.
The hope it gives me is that I will not be worried walking into a chemist and buying drugs for my child. I will see my baby grow up. I will see her children who will be my grandchildren. And when she becomes a mother, she will be assured of good quality medicines for her children.
Beryl's daughter made a good recovery after a second course of antibiotics. But the hope is that soon, buying drugs in Kenya will become less of a lottery and more of a win all round.